Hey guys, welcome back to another rapid update. In this video, we're going to talk about, does COVID cause diabetes, or is this just a case of bad science? Stick around. So a couple of days ago, this video was published on the internet, in YouTube specifically, and you're welcome to do a search and find it yourself. The topic is Study Finds COVID-19 Increases Chance of Diabetes. And this is by a South African media company, ENCA. They're reporting on the vaccination program coordinated by Discovery Health, and a study that they had conducted in South Africa on some outcomes that were related to the COVID vaccination program. So I'm going to be playing portions of this video to you. I'll pause on specific elements to emphasize the specific phrases and words that are being used, and then I'll return to analysis at the end to talk about whether COVID in fact causes diabetes, or is this just a case of bad science.
Players are stepping up to help government vaccinate as many people as possible. Reporter Rianta Padiachi visited one of Discovery's biggest vaccination centres in Johannesburg to see how things are going. And she also got an update on a recent study by the company which reveals very worrying findings about the effects of COVID-19 on patients long after they've recovered.
So notice that she used the word the effects of COVID-19 on patients long after they've recovered. This word effects has a very specific meaning in the context of science and building evidence.
Soon, this vaccination site will be inoculating 4,000 people a day. Overseeing operations is Dr. Ron Whelan. He heads up Discovery's COVID-19 task team. The health insurer is helping government ramp up its national rollout. It's also recently carried out a study to assess how effective the Pfizer vaccine is.
Even though this is the first dose, the results look very, very good. So what we're seeing is a 47% reduction in infection risk 21 days post your first dose. So globally what we're seeing is about a 33% reduction. So
have a look here at the specific words that are being used. So this is a study. We're not sure what type of study was conducted by Discovery Health, but I'll take a stab at guessing at precisely what they did here. And then they mentioned can cause. So there is some uncertainty, of course, in the word can. It's not saying that it definitively does, but this causal effect, or this causing diabetes, the utilization of this cause is problematic.
Results really look quite promising.
But the study revealed far more concerning findings. While COVID-19 is known to have a more severe impact on people with comorbidities like diabetes, the study found that the virus can cause diabetes.
Note, can cause diabetes.
What we found is a 2.75 times higher risk of contracting diabetes on the back of COVID. And in fact, if you've been hospitalized, you've got a 5 times higher risk of contracting diabetes on the back of COVID.
Okay, so we'll return to these numbers of 2.75 higher risk of contracting diabetes, and also amongst the hospitalized group, a 5 times risk of contracting diabetes. So let's jump into a quick analysis. In science, in order to definitively identify whether COVID-19 is in fact causing diabetes, one would need some form of a clinical trial. And clinical trials are usually designed as follows. From the general population, we're extracting 2 groups, or it's potentially more groups, but it has to be at least 2 in one group over here and another group here on this end. And this is either the process of first defining your inclusion and exclusion criteria at the population level, then extracting them on the basis of randomization, so giving each group here, the X and the Y group, an equal chance to be allocated into each of these, because what we're trying to do is address any potential bias that may be be linked to the variables or the factors that impact each of these groups over here. So the sameness in quotes is a key feature of doing research. What we then do in clinical trials is we then introduce an additional intervening variable or a treatment, or just an additional variable into this group over here, but we don't do it in group Y. So for all intents and purposes, what we're testing is, given that these groups are precisely the same, and this is usually reported in table 1 of the clinical trial, kind of the baseline characteristics and the demographics of both of the groups. But then we're introducing a treatment or an additional variable, and we're determining how will group X change compared to this group Y over here. And in this context, if we were doing a COVID-19 study and determining the impact on diabetes, what we would need to do is take healthy patients from the general population, allocate them into 2 groups in some randomization form, and there's many different forms that you can look up, and then you are exposing this particular group to diabetes, to COVID, and determining whether, as an outcome, it results in higher rates of diabetes. And this group over here would not be exposed to COVID. And this is how we determine it. It's very likely that at Discovery Health they are not doing here a clinical trial. Instead, what we're dealing with is something that looks something like this. So from the general population, there's only one group that's been extracted. That one group has a bunch of defining variables, and then coming out of that are specific outcomes that the researchers are giving us. This is on observational study, and it's very likely that this causal relationship that they are trying to establish between COVID-19 and diabetes is related to pre-diabetic patients that are being picked up in the screening program, perhaps measuring the HbA1c levels, for instance, and showing that they are at a higher risk, or they are in fact diabetic or moving in that direction. And therefore, the vaccination program at Discovery Health is in fact being quite successful. And this explains the 2.75 higher risk of contracting diabetes. Like I said, this study over here is not designed for the purposes of determining a causal effect of COVID-19 on diabetes. It's purely an observational study. There's no control arm whatsoever. It's very likely that what they're doing is they're picking up pre-diabetic patients in the screening and then reporting them as a cause and effect relationship, and this is not true. The other statistic that was mentioned was that hospitalized patients are at 5 times greater risk of contracting diabetes. And if you then subdivide this population into subpopulations, this group that is being hospitalized, it's very likely that they have multiple comorbidities. So prior conditions, cardiovascular disease or history of myocardial infarction, ischemic stroke, obesity, amongst quite a few others. And of course, very closely related to that is it's likely that they may already be diabetic and not diagnosed, or pre-diabetic and also not being diagnosed too. So this Discovery Health program has been very effective at picking up those cases, but it is certainly and absolutely not designed to state that COVID-19 actually causes diabetes. Anyway, to close off, I don't think there was any malintent at Discovery or at the media company to report this causal relationship that COVID-19 causes diabetes. What it points to is the lack of science literacy within the healthcare media in order to understand the basics of clinical trials and observational studies and what you can say and what you can't report. And then more importantly, though, it also suggests that there is no peer review mechanism at Discovery Health in order to prevent poor science from driving fear in society. So with that as a wrap, thanks so much for listening. Appreciate your attention, and enjoy the rest of your day. Take care.